They told me that I need operation on my gums. And I had pockets that is 9 millimeters. And all of these pockets was terrible. The teeth start to shaking. And I thought I will lose my teeth. I took the nutritional powder and all the kit with the book and everything that I needed, because that was my last chance. And I see big difference in my energy level. I see big difference in my pain level in my arm. Now the pain, I can move my arm without problems. With me was all the two doctors with all the paperwork in Carrington College and another place. They asked me what you did, because they have records before. And I told them, everybody, I told them about you, about the powder, about everything. And they say, really? I say, yeah. Remineralize all the 4 teeth down. It have one like line where until where is the remineralized, you know?
So you could see where the teeth.
Uh-huh.
You could see where the tooth has been remineralized.
Yeah. Mm-hmm.
Wow.
And now the pockets, only 2 or 3 of them I have. That is 5.
So it's so your pockets went from 9 millimeters to 5 millimeters.
To 5. Yeah. Mm-hmm. But they are really amazed of the results that I have it overall wow. Of the teeth, you know. They see the difference before and they see the difference now.
We're going to discuss how dental problems and specifically issues with your airway, your oral cavity, can be linked to a lot of the health issues that people are dealing with, such as insomnia, such as chronic pain, even mental health issues like anxiety and depression. And we're going to get into it. But first of all, thanks so much for being here doing this interview.
It's my pleasure.
If I could just throw out an initial statement, is there a link between your oral airway, poor dental health, and things like insomnia, chronic pain, depression and anxiety, weight gain or inability to lose weight?
Yes, in the sense that they all stem from the same problem. And the common core problem would be the narrow jaw. So we're, as dentists, looking at the orofacial complex.
Yeah.
And we're checking for cavities and gum disease, but airway-centered dentists go beyond that and look at the anatomical structure of the jaw. And so if the jaw is narrow, the airway is narrow.
Okay.
Yeah, and so if the airway is narrow, we're going to have a little bit more difficulty breathing. Mm-hmm. Of course, we adapt to that, but especially at night. We will end up suffering a lot more, and then we see manifestations of that in multiple dental diseases that we see, tooth decay, gum disease, various issues, tooth fracturing, but we also see the medical issues like what you have just listed, and many, many more actually.
Wow.
Yeah. Mm-hmm. But 9 out of 10 people in America have things like depression, anxiety, weight issues, cardiovascular, diabetes, thyroid problems, ADD, ADHD, infertility problems, insomnia, chronic pain. Those things are very prevalent, and we're finding that these people have that same narrow jaw.
Sleep issues, insomnia, just poor quality of sleep. What's the link between poor dental health and airway-centered issues and sleeping problems?
So, as I just mentioned, when we have a narrow jaw form, that means our airway is also narrow as well. Mm-hmm. And people with a narrow airway will tend to have sleep disorder breathing, such as sleep apnea, where they're not able to get air to flow through either easily or at all. So we see patients who stop breathing multiple times throughout their sleep, or even if they are breathing, it's just not a sufficient amount of air and oxygen. Mm-hmm. And so then the brain recognizes that, and in order to keep our bodies alive, the brain is very, very intelligent, so it tells us to compensate. It tells her jaw muscles to do certain things like grinding, bruxing. It definitely will tell us to open our mouths and start to mouth breathe. And so a lot of these patients will have some manifestation of sleep disordered breathing, which in turn becomes a core cause of things like insomnia, chronic pain, weight issues, depression, anxiety. I mean, about 90% of patients with depression, anxiety present with sleep disordered breathing.
Oh, wow.
Yeah, and generally it's accepted as universal that psychiatric disorders come along with sleep disordered breathing.
Whether it's some form of insomnia or sleep disturbances, at the core of that, it could be a dental issue, poor dental health, a narrow airway, and so this might be something that people wasn't even on the radar. Now, what about chronic pain, like those types of issues? What's the link there?
Yeah, well, I have patients who come in with pain, and it could be generalized pain, people with fibromyalgia, for example, which is an autoimmune problem, and we just talked about gut dysbiosis being an issue. And I have patients with, head and neck pain that has links to their jaw, and I can tell you that it has relieved my patients of pain.
Really?
So yeah, head and neck, definitely. Patients who are telling me they just sort of live every day with pain of level of 7 to 8 out of 10 are now only experiencing perhaps 1 to 2.
Wow,
at
that's
most,
huge.
At most, yeah.
That's huge.
It's a huge jump, yeah.
And that's just by expanding.
So there's multiple levels of treatments that I do. Some TMJ splint-oriented treatments, and that I do airway-centered as well. I make sure the jaw has room to come forward, to open up the back of the throat for increased airway. And then there's patients who move into the expansive therapy where we're actually growing the jawbone to become wider. And definitely those patients are experiencing a slew of positive effects that are similar to the TMJ splint therapy.
Wow.
The TMJ splint therapy is still where you're depending on the device to get these results. But once we move into the actual expansion, then that sort of becomes your own body, like the body that is capable of breathing really well on their own, because we're now changing the structures and improving it.
Wow.
Yeah.
And so that's not surprising that chronic pain would be a part of this, because I remember reading a study where the scientists that were conducting the study, I think it was took 18 healthy women, and just by sleep deprivation was able to induce fibromyalgia-like pain in 3 days or 5 days, something, a very short amount of time. And these were healthy women. And they had them, essentially gave them fibromyalgia just by depriving their sleep. And so fixing the narrow airway, poor dental health, thus fixing the sleep, is going to help people who are dealing with chronic pain and they don't know what to do.
There's also research that is showing that poor quality sleep is consistently resulting in pain the next day. And when you get good quality sleep, that pain gets alleviated, similar to what my patients are experiencing.
Yeah.
And so the same patient can come in and be great with the cleaning, no sensitivity, and then the next appointment they're extremely sensitive. And we're not using any different equipment. We're using extremely low power ultrasonic. And as a sleep airway dentist, I'm always asking those questions about sleep quality, and patients will always tell me, so when they're showing me those symptoms, I know that they didn't sleep well.
Wow.
And then I get to start to talk to them about it and try to help them with that, basically.
How about that? So in my mind, that's a really clear link between poor dental health, airway issues, and chronic pain. So that could be something that people who are dealing with chronic pain might not even be on the radar. They're receiving all these medications, and maybe there's other issues. Maybe there's some got in a car accident or something like that. But this narrow airway problem could be what needs to be addressed. So that's really helpful information for people to know. People are probably dying to find out. So what do you do? What are these devices you're referring to? So could you just it's probably, somewhat complicated. In a nutshell, explain, what do you do, what devices do you use, what are they doing in your patients?
Well, the types of appliances that I use, we have what we call stem cell signaling, and that could sound sort of out of this world for a lot of people. And
yeah, fascinating.
Yeah, and the term stem cell has been thrown around so much, but it's basically something that our bodies already have. It doesn't have to be synthetically fabricated with rocket science in a lab for you to get stem cells. It's just something we're born with. Stem cells when we're young act as growth factors. Stem cells when we're older act as healing cells. So, when we're wounded and there's inflammation, it comes to help us to heal. When we're younger, it helps us to grow. But if you signal them just right, then it could actually help increase that that growth factor, basically. So osteoblasts and fibroblasts and all those blastic cells. So blastic cells, stem cells, mesenchymal cells, those are all kind of the same thing. And we're signaling them so that they can start to help us grow some bone in the areas we're kind of putting a little pressure and trying to expand and stretch out to. Literally, we get bone generation.
Wow.
Yeah.
So let me see if I understand this correctly. You're putting in devices that are removable for adults that actually physically, slowly but surely expand the palate, but at the same time will actually signal stem cells to come to the area and start to regenerate.
Yeah, so you're literally increasing the amount of stem cell activity.
Wow.
Yeah, and it's all
That's
natural too. It's not like there's a motor in there and like there's electricity or anything like that. It just uses your body's natural vibration. It's just made in a way where it can just kind of conduct it through these special springs that are in the device, and it conducts it through the teeth into the bone.
Wow.
Yeah.
That's fascinating. Now, I want to get into a little bit of like what you see. You've been mentioning it throughout, our discussion, but what are some of like the results that you're consistently seeing when you treat your patients successfully and you're able to expand their palate and open up their airway? What are the types of things that you're seeing happening?
Since I'm a dentist, the first thing I want to mention is that I see a decrease in plaque level in the mouth. Yeah, so just by decreasing the grinding and clenching that occurs as a side effect of the narrow jaw, decreasing the mouth breathing, increasing the nasal breathing, just the oral bacteria becomes healthier.
Wow.
Yeah, so we're seeing a lot less harmful bacteria, and as a result of that, obviously, we're going to get less tooth decay.
Yeah.
And because we're reducing the clenching and the grinding that happens as a side effect of narrow jaw, we're also reducing the trauma on the teeth. And reducing the trauma is going to contribute to less fracturing, less wear and tear, and also less recession of the gums. Yeah, so all of that kind of works in harmony. So that's definitely some of the results. In some cases, I actually see improvement in recession. Yeah, so it all kind of depends on your pre-existing and what's going to change. But there's the dental benefit there. Everyone unanimously, obviously, is sleeping better, less fragmented, able to sleep through the night, and also getting up in the morning without all the trouble that they used to have. Yeah, so there's that. Everyone's definitely looking brighter and younger.
Wow.
Definitely patients are telling me they're losing weight, their jawline is slimming. So it's really funny because I'm increasing their jaw in size, but then they feel like their jawline is slimming.
Interesting.
And what a lot of people don't realize is a side effect of the narrow jaw is actually your jaw muscles getting bigger and bigger. Yeah, and jaw muscles getting bigger is going to cause some of the bone to kind of increase and thicken as well, because that kind of goes together. But as a result of giving my patients an opportunity to function normally and in a balanced fashion, those muscles that don't need to be that big just kind of decrease in size. And that is where some of the jaw slimming effect comes along. And mood is better. Of course, in the sleep data that we see, deep sleep, REM sleep is better, oxygen, things like that.
Fantastic. So it sounds like everything gets better.
Everything just falls into place. It's like our bodies were meant to be healthy.
Yeah, it's like the default is health.
That's the default, and
Wow.
we're just bringing them back to nature, basically.
So cool.
It seems like it's the newest thing, but then at the same time, we're kind of going back.
Right.
Yeah, we're going back to nature.
We've kind of touched on it a little bit, but if you think about how we've been degenerating really as a people, and for the last 400 years, and a lot of the problem, if not the sole problem, was this nutritional degeneration. We started eating really poor quality modernized food. So would that imply that the way that someone at home could start reversing this on their own would be through nutrition?
Yes, absolutely. So I nutrition counsel my patients all the time. I spend a lot of extra time in the chair just on that. So since diet change to something really bad from something really good suddenly caused this drastic change, yes, absolutely, we can reverse this. So even if we're not getting all the structural, therapies that, I render for my patients, lifestyle is extremely important. So, our soil is very depleted in nutrition. And so even if we're doing all whole foods, organic diet, which I'm constantly trying to do, I'm fully plant-based, we just don't get the proper amount of nutrition density in our food. So how do we increase that density? I know you have this wonderful green powder, and it's the least processed you can find that is very easy to keep on the shelves, that doesn't go bad easily. Put it in your smoothies or mix it in some water and drink it. But that is definitely a great way to give it a nutrition boost. But that's one thing, and I'm aware that not all of these supplements are going to be very high in nutrition per se, so really look at who's making it. I know that yours was nutritional value, when you've tested it, was equivalent to like a 16-ounce bottle of concentrated juice, for example. So something that is nutrition dense, that we're not stuffing ourselves with extra food, but we're getting the proper amount of dietary fiber, not overdoing that, but then the nutrition that goes along with it is also very, very dense. Soaking in sprouting could be one way to do that. Gardening your own vegetables.
Oh, that's the best. I think people can do that.
And from gardening, you get the sunshine, you get the fresh air, and getting proper vitamin D from the best source, which is outdoor sunshine during midday, when the shadow is a little bit shorter than your body. That's the best time to get the vitamin D, and you're going to actually get more from that. So those are some things nutritionally that I can kind of just touch on.
Well, that goes right along with my research. When I was able to reverse my cavities, what I found out, well, the thing that was shocking to me is 75-80% of my cavities I got while I was a plant-based vegan, not a junk food vegan either. And so that really was like a head scratcher for me. And what I ended, as I delved into the research, what I found was that that's a good basis, but it's not enough to get you past the line from survive into thrive.
Exactly.
And I needed some kind of a supplement to get me there. And the supplement, instead of like some synthetically lab generated, like 50 different pills, and I have like, every vitamin, but it's in its separate synthetic pill form. Just getting it in its original packaging was the best. Plant. So juicing was a huge thing for me.
Absolutely.
But also nutritional powder, and that's why I created that nutritional powder, and it's having it be focused on all the vitamins and nutrients that are specifically needed, most important for building teeth.
Not only that, everyone's so busy. I diet coach, lifestyle coach my patients all the time, but there's really only so much they can do. And even for myself. So I do supplementation based on, I know when I'm not eating well, and I know when I'm eating well, like if I cook, and so it's really hard to balance. So the powder really helps, because juicing, I love juicing. And when I juice, like for example, if I bite my lip and I get an ulcer, it takes like 5-6 days to heal when normally it would take over 2 weeks. So the green is definitely powerful, and so I would say go for the nutritional supplements, but the whole plant made into a supplement basically is the best. For
those that are interested, I'll have a link in the description to my my reverse cavity protocol kit, and the nutritional powder is part of that, and it could also be purchased separately as well, but the whole kit is obviously going to be more beneficial.
I was very impressed with that at being your doctor. I was very, very impressed. So yeah, this is definitely something that should be shared, and everybody could just do this. And you know, we try to put a price tag on things, but you don't get your enamel back once it's gone. Yeah, so don't damage it, and if it's getting damaged, just stop it right there and supplement that nutrition internally, not just topically. Like we put things on the teeth. I recommend bentonite clays and things with all kinds of minerals, like you know, diatomaceous earth that has silica. But internal boost is going to be extremely important. Our teeth are not inanimate hard objects. It has pulp tissue inside of it, and a lot of people know that pulp tissue has nerve inside of it. But what else it has that a lot of people don't know is blood vessels. So those blood vessels are carrying nutrition to the tooth. So that's the reason why you were able to reverse it. So there you go.
And I remember you saw my x-rays, my before and after x-rays. And
they looked beautiful.
And I think it's just affirming. People hear me say all the time, teeth can remineralize, remineralize, but I think it's so affirming for people to hear that from an actual dentist. This isn't a crazy Gabe thing.
So all dentists are going to recommend something to put on your teeth to remineralize, and it could be chemical. Some dentists who are more holistic are going to recommend more natural things like I do. But the internal is usually not addressed and even thought of as possible, but it definitely is going to make a difference, because this whole problem started with diet. Remember that.
You got to address it from both.
From both angles.
Now, people are probably wondering, okay, I need to expand my airway, I need to, I want to move on this. What can people do now, because here we are in San Francisco, California, at one of your offices here. People are watching this all over the place, all over the world. People are going to be watching this. What are some things that people could start doing today, and maybe they could do, a month from now, to help? Practical things people could start doing.
Consider getting Gabe's nutrition powder, and I say that because I spend hours and hours and lots of energy and effort diet, lifestyle coaching my patients, but everyone is so busy. And I sometimes feel like I'm burdening them by giving them advice, because now they have to add 3 more steps to their daily routine. And so really consider doing something like that. And if you have more time, then consider getting better quality grain. Try to reduce the whole wheat or the processed wheat or the whole wheat, just because it's modern wheat. And modern wheat can do similar things to your body that sugar can do. So go with the more ancient, original grains, or even pseudo grains like seeds, like quinoa or amaranth. Ancient grains could be acorn, spelt, rye, things like that. And look at the ingredients of the bread that you're buying. I don't really like bread as much as just having the whole grain, so I'll have it as cereals or cook it as a rice or something like that. Have a healthier, just in general, if anyone is meat eating out there, you want to drain the fat and blood. That's the best way to consume meat. If we're consuming meat, of course, best quality, and the grass-fed would be awesome. But still, the blood carries toxins throughout the body, and the fat stores the toxins. So you don't want to be consuming that. When we're trying to get rid of the toxins, we get rid of the inflammation.
Great explanation. And if people want to see more information on that, I'll have a link in the description below to my video where I explain how I reversed 5 cavities in 3 months. And I went through, a lot of the science behind that, and what Dr. Weston Price found out, and my own experience, and to show more proof and evidence to support this, and to really see the science of how you can reverse cavities. I was able to reverse cavities even with having a narrow airway. with decreasing the inflammation there through my oil pulling blend, with boosting the nutritional content of my body through the powder. But also a big part of it was being outside, getting vitamin D. If you don't have adequate vitamin D, one study I read says you can only absorb about 15% of calcium without adequate levels of vitamin D. So, and you could supplement with vitamin D. The sun is actually the primary source. It's the best. There may be some issues with supplementing with vitamin D. Better than nothing, probably. So, obviously, one thing that people could do is they could hop on a plane and come over and see you, depending on where they are, which obviously is going to be the more expensive, but I mean, that's something that people could do if they wanted. They could actually come see you and have you treat them. Do you want to speak to that at all? Or?
Yeah, so I do have patients who fly in from out of state to receive this treatment, and that attests to the fact that it is a little bit on the rare side to find a practitioner. And I guess one of the things that my patients like about what I do is it's more comprehensive because I address the jaw, myofunctional, the expansion, and the ortho, all aspects of the full scope of airway dentistry. And also I am also holistic, and I'm able to help them in other aspects of lifestyle change as well. So that's a benefit. Nevertheless, there are airway dentists in other parts of the country, and it is increasing. More doctors are doctors who are really motivated to save lives and to who are really concerned about the health of people, are really investing, because it's a huge investment to learn more about this and to learn how to do this. For me, it was a whole career-long path. So you can try to Google search airway dentist, airway-centered dentistry, any other functional myofunctional therapy or oral myofunctional therapy. Those are some, words that you can use to search that could potentially lead you to a clinician, who can potentially help you in that area.
So you don't want to hop on a plane to go to San Francisco, so there may be someone a little bit closer to you, and this is how you might find them.
You can, and I would be honored if one of Gabe's audiences came and sought me for help. And I will do my very best to take the best care of you. But
she's the best.
Thank
Very
you.
good. Very good.
Appreciate that.
We had a conversation about this, and the thing that came out that I think is really important that I think our viewers need to know is that you may have gone to your doctor and told your doctor, you know what, I feel like I have sleep issues, and your doctor may have, based on just whatever parameters they use, say, no, you don't have sleep apnea, or no, you don't have sleep issues, you're stressed or whatever. And maybe you are stressed, but what I want to ask you is, could you actually have a sleep apnea issue under the radar? It's just not being picked up by your primary care physician.
So they tend to focus more on patients who are a lot more severe, like moderate to severe level obstructive sleep apnea and central sleep apnea. And so I see a lot of my mild patients getting dismissed by medical, but then at the same time, they're being told that they're fine, like just sleep on your side. And sleeping on your side is great, but it's just that they don't qualify to get something like a CPAP machine. And I'm seeing that that's basically what's going on. And when we're, as airway sleep dentists, we look at all of our mild patients and see that there are so many slew of health problems going on from the mouth to systemically. And I have patients who have been rejected by providers to get any sleep apnea treatment, just suffering immensely. I had patients who couldn't get their knee surgery done because their inflammatory markers were so high. And when I was able to put them in some sort of a device that helped to prop open their airway a little bit, they were able to go and get their knee surgery done, for example. And so we look at everything from sleep apnea. We look at all of our mild patients because those mild cases do eventually develop autoimmune disease and different manifestations, chronic problems. Like my athletes who have a really wide open airway down here, but then up here is very narrow.
Yeah.
And so they still wake up with pain every day, and their oxygen is still very low in their sleep test when I do sleep quality testing. And so, you know, when I put them in a device and they're able to nasal breathe better and get more oxygen because they're nasal breathing, they wake up with less pain in the morning.
So just because your primary doctor, or even perhaps even a specialist, says, no, you know, you don't really don't have or qualify for sleep apnea, they may actually have sleep apnea. It's just at a lower chronic level. That
yes, it could either be lower chronic, but by definition, it's not precisely sleep apnea. It could be, you know, they're still sleep disturbed, but it could be what we actually diagnostically call upper airway resistance syndrome, for example.
Well, I remember because, you know, you had me do a sleep test. So Dr. Bong has actually, I'm one of her patients. She started treating me. And, you know, I was able to fix my own, you know, reverse cavities and decrease inflammation with my own kit. But there was still underlying issues that she was able to address. So it's kind of like, you know, you have a coin and you have two sides of the coin and you could address one, but that doesn't mean that there's not another side of the coin that needs to be addressed. And according to the test that we did, I had mild to moderate sleep apnea. Yeah. But when I brought this to my doctor tried to get me an actual official sleep test where I go to the sleep lab through you know, the hospital system. Insurance rejected it. Yeah. They said based on all these reports, you don't have enough of an issue or really have an issue to justify this test. Yes. And I was surprised because the study that, you know, we had done showed that I had at some point my oxygen saturation was getting down into like the low 80% at night. That's an issue, you know, but for them, so one thing I just want to bring out is that, like, you could have an issue even though your doctor is telling you, like, no, you don't have an issue with, you know, you're not a sleep apnea patient. You could still have a sleeping issue that's causing your chronic pain, that's causing your inability to lose weight, that's causing, you know, a slew of other issues.
Yeah, and in your case, you may not have active snoring problem. Potentially you might snort once in a while, but we have silent sleepers who still stop breathing in their sleep, and we see that. I have had some patients occasionally where they're actually the ones who come to me telling me that they're snoring a lot. And once we go through the steps of discovering what the issue is, they would go to, you know, their medical physician, and then they will be told that they don't have a sleep breathing problem. And again, it could be that I didn't really get to figure out exactly what specialty they saw or if they even saw anybody with a specialty. But it could be that they only had like a conversation with the primary care physician, who usually is not the person that you want to go to get this information. You do want to go to a board certified sleep physician who are going to recognize the fact that there is something going on. It's just that there isn't much more that they're going to be able to do for you besides surgery and or a CPAP machine, which could be a little bit aggressive for somebody with mild sleep apnea. Yeah, so that could be the case for some patients, but some patients might just be at the level of their primary care, and they're not really focusing on sleep, basically medicine. And so and then there's the whole insurances. Kind of pulling the plug on everyone's actual healthcare needs. But you do some more research on it, read more. I'm happy to post my website as an educational resource for everybody.
We'll have that in the link description, the link in the description.
It's called revivesleepstudio.com. But from there, read some books on it and try to find a practitioner in your area. Tell your friends and family about it, that there is a way to be healthier. And a lot of people who hit rock bottom or hit a wall trying to do all these different regimens and like the weight's not improving or whatnot, you know, this is something that you can tell them about, and people could have more hope. Or at least answers if there's no therapy being rendered. And having answers is huge.
Well, Hyun, Dr. Bong, thank you so much for being here.
It was an honor.
This is a blessing, and Again, all the information is going to be in the description below, links to your website, and I recommend going and reading the things that she has on there. I hope this has been fascinating, interesting to you, and I would just like to say thanks for watching, and may you be blessed in your pursuit of dental health.